Hi, my name is Alyssa, and I am an internal medicine resident physician. This is my 5th year of medical training and my first working with a primarily HIV-driven clinic. Like many of us, I had some internal biases and stereotypes going into this clinic. However, I realized that the stigma associated with HIV could not be farther from the truth. Most of the patients I interacted with were no different than you or me. They were teachers, delivery truck drivers, churchgoers, community volunteers, sisters, fathers, and so many other titles. I heard stories of trauma, recovery, and years of battling the disease of addiction. And with each story, I listened and learned and became more understanding of the patients I treated that had HIV infection. These experiences helped me understand how I can be a better provider and help manage and treat HIV at an individual and a community level. HIV does not discriminate based on age, gender, or sexual orientation. It can impact our family, our friends, and people in the community we interact with on a daily basis, and you would never know. Public health measures and research over the past several decades have saved countless lives from the HIV epidemic. Many of our patients live long and happy lives because of the medications that have been developed and various public health initiatives that have helped prevent and manage HIV. For these reasons, I am even more concerned and disheartened about the latest removal of the HIV guidelines and prevention strategies from the CDC website, following President Trump's executive order. Research must continue, and we must have access to evidence-based guidelines to manage the HIV epidemic that is still in our country. These patients sitting before us deserve the best quality care, and having access to evidence-based practice and the most up-to-date guidelines is essential for their well-being and for our ability to provide the best care. I'm asking for you to learn and listen with me so that we can be better advocates for our patients in the community. My patients with HIV deserve access to evidence-based medicine and up-to-date guidelines, and we must all be able to speak up and advocate together to get these guidelines reinstated. Patients with HIV are just like you and me, and they deserve the best quality care.